We are at an exciting moment in neuroimmunology, where boundaries between conditions are becoming clearer, yet understanding mechanisms continue to surprise us.
Are we aiming at a treatment, perhaps a lifelong or a long-term treatment, or are we aiming at a cure?
Importantly, we must remember that paramagnetic rim lesions in MS have not only a diagnostic role, but also a prognostic role.
Patients have impaired functional connectivity, specifically of the hippocampus. They have also atrophy of the hippocampus, and what is interesting, they also have damage of the white matter quite extensively. And all of these findings correlate quite well with typically persistent cognitive deficits.
Really depends on the setting whether IgG4 can have beneficial or pathogenic effects, and there's just now a whole range of disease settings where IgG4 seems to play a role.
Broadcasting directly from Barcelona, Spain, you're listening to the ECTRIMS podcast, the official podcast channel of the European Committee for Treatment and Research in Multiple Sclerosis. I'm your host, Brett Drummond, and welcome to this special Congress series. This September, more than 9,000 researchers, neurologists, and experts from every corner of the globe have come together here in Barcelona and online for the 41st ECTRIMS meeting. The largest gathering of its kind, ECTRIMS is where the MS community unites to share knowledge, debate new discoveries, and push the boundaries of science and clinical care. On this opening pre-day, the spotlight is on rare neurological conditions, NMOSD, MOGAD, and pediatric MS, as well as others. There are areas where progress is urgently needed, and today's sessions highlight the innovation and determination driving the field forward. It's the perfect start to a week that promises to inspire, challenge, and reshape our collective understanding of MS and related disorders. Today, we bring you the key highlights of pre-day at ECTRIMS 2025. Joining me is Alvaro Cobo Calvo, a neurologist at the Multiple Sclerosis Centre of Catalonia, Cemcat, here in Barcelona, who is an expert in these rare neurological conditions and who will share unique insights from an exciting pre-day at ECTRIMS 2025. Alvaro, thank you for joining me.
Thank you.
So, before we get into the episode, we've just had pre-day at ECTRIMS 2025. It's obviously a relatively new addition to the program at ECTRIMS. Can you tell me why you think it's a really important addition that we've added to the program in recent years?
Thank you, Brett, for this question. Indeed, this is the second year that the pre-day have been organized by ECTRIMS. Last year, almost 500 assistants attended that pre-day. And this year, these figures, I was listening to Bruno Stankov at the presentation, that has increased till more than 1,000 assistants. So I think that reflects the good support of ECTRIMS and that this is a very good event. We are talking about rare diseases such as NMOSD, MOGAD, or encephalitis that deserve maybe a more separate space, at least for these educational sessions, since in 2 or 3 days for multiple sclerosis, sometimes there are no enough space to give this more dedicated or to study more in depth these diseases. So I think that certainly I'm very happy with these 3 days. I think that this has been a successful today. And I hope that next years the ECTRIMS will keep these sessions ongoing. Yeah.
And I think that was what you said there was really noticeable in the room today. I think I arrived 2 minutes late to the first session and it was very hard to get a seat in the room. There were so many people interested in what was being discussed today. And I think that reflects what you just said in terms of the importance that we are discussing these and that they have their own space in the program, but also the exciting nature of the science that was being presented today. For you, what sessions or what topics did you find the most exciting, the most interesting?
Well, indeed, there have been many exciting sessions performed by leaders of all this field. I especially liked these sessions focus on some challenges about diagnosis, mainly in diseases that sometimes can overlap, such as, for example, MS and multiple sclerosis. And the first sessions were dedicated more in depth to the MRI changes of patients with MOGAD, because sometimes these patients may have overlapping features with those of MS. There were two interesting sessions talking about dynamics of MRI features in these patients, as well as another one about the impact of CBS and PRLs on MOGAD. I think that this is highly relevant because there is a gap in knowledge a little bit about the MRI in deep or dynamics of MRI in MOGAD. Mm-hmm. And what the speaker highlighted was that the clinics, sometimes the clinics features of the patients are visible before the MRI. So sometimes we have a florid picture of symptoms, but when we perform the MRI, we just find subtle changes or subtle lesions. So they highlight the fact of rebaseline the MRI at least some days later. Also, in order to differentiate these MOGAD patients from MS patients, it's important to perform at least 3 months, 6 months apart new MRIs because in order to differentiate when there is reasonable depth between two diseases, since it's typical that MS lesions persist over time while MOGAD lesions tend to disappear in a high proportion of them. So, I mean, this is just an example of what they touch. I feel this topic very, very interesting. There were other interesting topics, but...
I mean, I think that topic is critically important. Over the coming days, we're going to be hearing more about the new MS diagnostic criteria that have just been published in Lancet Neurology. We've got new NMOSD diagnostic criteria. So, and they are all using advanced imaging now being included in these, so it's really important, as you say, to get quicker diagnosis, to get accurate. How do you feel we're progressing with that in some of these rare neurological conditions in terms of, improving how quickly we can make that diagnosis, how accurately we can make that diagnosis?
I think that we are living a change of paradigm, I think, not only in these inflammatory diseases, but also in neurodegenerative diseases such as Alzheimer or Parkinson. Indeed, there are already some panel of experts suggesting that the Alzheimer's disease diagnosis could be done based on the biomarkers. Now in MS, the new criteria have incorporated these biological parameters in the criteria with the aim of diagnosing patients with mild symptoms, which is very important logically in order to have a prompt diagnosis and start earlier treatment and consequently to improve prognosis. In NMOSD disorders, we are the 2015 criteria based mostly on the aquaporin 4 antibodies to make the diagnosis, always having some symptoms and MRI features characteristic of NMOSD. There is still a proportion of patients who are seronegative or where we really do not have an underlying biomarker, and I think that we have to work on that direction of biomarkers in trying to disentangle this proportion of patients with a seronegative diagnosis, because it's likely that there will be another biomarker. Maybe the pathway won't be a B mediated, but also or T mediated disease. But we need to work on that direction, and I think that I don't know if the next, but in the few next years we will advance on this definitely.
Yep. So I guess biomarkers important in diagnosis, also important in treatment monitoring. MS, I would say, has been one of the biggest success stories in modern medicine in terms of the explosions of treatments that we now have. We're obviously hoping a similar pathway will happen for some of these rare neurological disorders like NMOSD, like MOGAD. There was a focus in some of the sessions today around what are the emerging treatment options that may help in these conditions. I'd love to hear your thoughts on those in terms of what they are and what you think might start to have meaningful impacts over the coming years.
Yeah, today there was Paul Friedman gave a nice talk talking about the future. Maybe it's a kind of mix of present and future treatments, focusing on of this new treatment that can pass the blood-brain barrier, such as the CAR T cells, in a different way that the depleting therapies that, although effective in patients with NMOSD, there might be a limitation of these therapies since they are not able to cross this BBB, this blood-brain barrier. So the CAR T cells, although we have preliminary results and the treatment have been published in series of cases, we need clinical trials to demonstrate that this therapy is useful in NMOSD or MOGAD without having relevant adverse events, because at the end we have to think that this therapy, before giving the CAR T, we have to make a high immunosuppression of the immune system with chemotherapy, and not all patients can keep this. So I think that this is very important overall, the clinical trials. But I'm convinced that the CAR T cells seems that have working in hematological diseases will have an impact on NMOSD and MOGAD. He talked also about tolerization therapies, but I think that there is a much more pathway to work on. There have been, he showed a clinical trial 1B performed by a Spanish Catalan group from Barcelona of tolerization of dendritic cells in MS. But as I said, I think that tolerization therapies, we need to investigate a little bit more further in this. And I think that these were the two main new therapies. Also, bone marrow transplant, that is important. Overall, in MS, have shown an efficacy on inflammatory forms, secondary forms with inflammatory lesions overall, not only in those patients with a pure neurodegenerative disease. And bone marrow transplant could be also an option to explore in NMOSD.
And is that one of the reasons why having pre-day as part of the ECTRIMS conference is really important? Because we're talking about things there, obviously HSCT, with bone marrow transplants, CAR T cells, things that potentially are working across all of these conditions. Is that why it's important that we're all coming together in one spot, MS, NMOSD, MOGAD? Because there is a lot we can learn from each of these conditions, isn't there?
Yeah, I think that the pre-day is more an educational day for these rare diseases. Then in the ECTRIMS, during the ECTRIMS, there will be scientific sessions focused on NMOSD and MOGAD. I think that the pre-day give us the opportunity to the clinicians focus on these rare diseases to share ideas and to propose new projects, and to have all these clinicians focus on these rare diseases at the same place at the same time.
Yep.
And this is very important because it's not so frequent to have international or global meetings focus on these rare diseases. And I think that this pre-day gives us this opportunity to talk with colleagues, plan new projects in a very busy but exciting day.
Yep. Well, it was a really inspiring day. I mean, as we said from the start, it was fantastic to see the growth from last year to this year in terms of interest in people in the room. For you, if you had to pick one thing that you took out of today that you're going to be really excited about, that you want to follow really closely up until next year's conference, what would it be? Hard question to just pick one.
Yeah. I mean, I think that the new therapies, as we have talked, we are facing a change also in the therapeutic field, and I think that we should keep attention and follow closely the advances of these CAR-T therapies in immunological disorders, not only in those focused on the central nervous system, but also in rheumatological disorders, because these therapies have shown have changed the life of many hematological patients, and why they do not change the life of patients with immunological conditions of the central nervous system.
Yep. Well, Alvaro, I want to thank you for joining us today and giving such a wonderful summary of pre-day. Fantastic way to start ECTRIMS 2025. I hope you have a fantastic next 3 days at the conference, and look forward to talking to you again soon.
Thank you for your invitation. Thank you.
Thanks everyone for listening. Be sure to join us again tomorrow as we continue our special ECTRIMS 2025 series, highlighting all standout insights of the day. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MS Translate. The ECTRIMS podcast is produced and hosted in collaboration with 2 key partners: MS Translate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community, and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2025-26 ECTRIMS podcast series is supported by educational grants from Alexion AstraZeneca Rare Disease, Bristol Myers Squibb, Novartis, Roche, Sanofi, and UCB. Educational grant providers have no input in the podcast content. Subscribe to the ECTRIMS podcast on all your favourite podcast channels, including Apple and Spotify. Visit the official ECTRIMS 2025 website to learn more about the ECTRIMS Congress, and join the conversations on X, LinkedIn, Facebook, and YouTube.